Anthony Melchiori, it's Tuesday. Great to see you.
Glenn Houseman with 2 S's.
I'm Anthony. Welcome to No Vacancy Live. That's my friend Glenn.
You're watching the #1 show in hospitality.
Anthony Melchiori, so wonderful to see you and your emerging beard. How's the growth going over there?
Well, me and myself and I had a conversation 5 minutes ago.
Yes.
I'm traveling for business the next couple of days, and I said, "Self, yes, Anthony.
Yep.
Are we shaving the beard or are we keeping the beard?" And we're like, "Let's put pin in that and come back to it later."
Right. So we'll see what happens. Stay tuned to No Vacancy Live for continuing developments on this incredible, important story.
This might have been the longest I've had my beard, at least publicly, for a long time. I'm trying to get. I don't know if you've been following Andrew Zimmern, but Andrew Zimmern is growing quite a beard, and I'm trying to grow his beard.
Excellent. Well, I'm going to start now because I hear I've got an audition with ZZ Top coming up, so I got to get started on that one.
All right. Without further ado, we have a very important guest.
No banter. We've got a whole lot more important of a show happening today. We're going to be speaking with industry icon Harris Rosen, all about the Rosen Medical Center, his RosenCare plan, and a couple of other gentlemen from there that are making it happen. But more importantly, this is all a lesson for how you hoteliers out there can really follow in the steps of this great man to help create a system that is really great for your employees. So let's
you know one of the things you use the word icon, and icon is sometimes overused, and I'm going to say the one and only, because there are other icons, but there's only one.
Yes.
I mean, there's only one. And he really is. He set the standard. He took chances where other companies wouldn't take chances. He did big things that were not only generous, but were bold and were other people looked at him and probably thought he was a little crazy. It was absolutely it's an honor to have him back on the show. And Glenn left, so I guess I'm hosting the show all by myself.
Nope, I'm back. Sorry. Little All right. I just wanted to keep you sharp there, Anthony, and you're absolutely right about that. The one and only, a gentleman who started an entire industry basically down there in Orlando with less money than bus fare, bringing in Mr. Harris Rosen. Sir, again, we are honored to have you with us today, returning to No Vacancy Live. Thank you for being here.
You guys are being much too kind.
No, I would argue we're not being kind enough because honestly, Mr. Rosen, I don't know of any other human being in the hotel industry that is doing and has done what you have for your team members. Rosen Medical Center and RosenCare is just the tip of the iceberg. You put so many hundreds, maybe thousands of kids through college. You have created a community of people that work with you that absolutely love and adore being part of your corporation. So every bit of praise that we're going to give you today is well-deserved. To be honest with you, we don't do a lot of that on this particular show. So thank you for everything you do for our hospitality community.
Oh, thank you so much for your kind words.
So the last time, can I ask a question? The last time we spoke, you were right at the beginning of doing something you've never done before, and having to not only close hotels, but maybe have to put people on furlough. And I remember looking in your eyes, and I remember getting off the podcast with Glenn, and I said, "Man, his heart is heavy." Heavy. So if you remember that moment, talk us through that. What were you thinking? And also, where are you now and how are things in the hotel industry down in Orlando?
Well, I've been in this business for a long time. 47 years we've had our little company. And before that, right after I left Uncle Sam, I was in the industry for about 4 or 5 years and wound up here in Orlando, and then decided that if I really was going to achieve the success I dreamed of, I would have to create my own little company, and that's what we did. In the 47 years we've been in business, never, ever have I experienced anything like what we've just experienced during the past year and a half. To suggest that it has been awful would be a gross understatement. It was terrible.
Yep.
I don't think I've had a good night's sleep in the last year and a half.
Wow.
Never, ever, ever did I imagine that I would have to furlough our associates.
Right.
And I did. And that broke my heart.
Well, Mr. Rosen, it was of no fault of your own. You had spent months putting millions of dollars of your own money into the company to prevent that from happening. But the length and depth of this crisis was so great. You were struck with that decision. Do I have to let them go? And if you don't, the entire company could unravel and you wouldn't be able to help people in the future, support their family.
Yes, I understand what you're saying, and what you're saying is accurate.
Yes.
But unfortunately, I wasn't able to focus on that part of the situation. I was focused laser-like on the great harm we were doing to all of our associates by having to furlough them. Now, the medical center right behind you was really a savior, because we kept it open, of course, throughout the pandemic. And our associates were able to go there and take advantage of the services. And that facility was very busy during that time.
I bet.
For a multitude of reasons. But it was so wonderful to have it, and so wonderful to be able to keep providing a service for all of our associates. And I'm really grateful for the team led by Kenneth, and the insurance team led by Ashley for doing such an extraordinary job in keeping our associates healthy during a very, very difficult time. So yes, it was teamwork, but it was very, very, very difficult. And my hope and my prayer is that never, ever, ever will we be in a situation like we were this past year and a half again.
Yeah. And it's amazing, because I remember you were 24 hours from making that announcement when you furloughed your team, and you were on our show. And I remember just looking in your eyes, and I mean, I held that for a while, just knowing, I didn't know what you were going to have to do, but I knew it was heavy. And being in the position you're in, that you don't have to worry and care about your associates, but you do, and you do it in a really, from your whole being. And people talk about culture. I wouldn't even use the word culture when you talk about your company. You just done things in a way that you not only put people first, you put them second and third in everything you do. And I think you're the first person that I've really met in this industry that understands the customer is a far second to your employees. Because if you don't take care of your employees, in a real way, we hear about now. Right now, we're suffering with all with a crisis, with finding good help, and I'm sure you're going through the same thing. But everybody knows if you go to work for your company, you're going to be treated with respect. You're going to be treated like family, and we'll have to talk about it. But
it's really interesting, Anthony, that you say that, because I do my shopping at a grocery store called Publix, and I shop once a week and prepare all my food on Sunday for the next week at home. And while I was walking around picking up various things I needed, a gentleman came over to me and he said, "Are you Mr. Rosen?" And I said, "Yes, sir." And he motioned to his wife to come over, and he said, "This is Mr. Rosen." And I said, "Hi, good to meet you both." And they said, "We just have to tell you something." I said, "I hope it's not bad." They said, "No. We have many, many friends that work for you. And during these very difficult times, they kept telling us how wonderful it was, not necessarily during the pandemic, but to still be cared about, and for you to show love and concern for them." And I said, "Boy, that's wonderful to hear from you." And they said, "Well, we saw you, and we just wanted to share that with you." And so, yes, we're different. They're not employees, they're associates, they're family members. And that was what made it so difficult, because they are family. And it was just awful.
Yeah, you mean Colleen, our regular fan saying you put tears in my eyes. Well, you put tears in my eyes, but I knew it was coming before you even said it, that they would be generous of spirit, just like you are. But you put things in place. It's just not your big heart. You put things in place in your company to support your team in a real way and put money out there before you would, basically make any money. And that's kind of helped you through not only the pandemic, but it's really helped your company become a company of true loyalty. And that's what we want to talk about today. So, Glenn, I'll let you take it away.
So for those of you the two of you out there who might not be familiar with Rosen Hotels and Resorts, they own and operate 8 hotels in the Orlando destination market with more than 6,300 rooms. Such incredible properties, such as
excuse me, we closed 2 little properties.
Okay.
Which we actually bought for the land to expand the Rosen Center.
Oh, excellent.
And we have 7 properties now that are operational. We may open one of the 2 that we closed. We have about 6,800 rooms total with the 7 properties. That would get us close to 7,000 with the potentially 8th property. So,
excellent.
So in Florida, outside of Disney World, does anybody else has more rooms than you?
It's interesting that you asked that question, because I read recently that we may be the largest independent hotel company in Florida, with close to 7,000 rooms. Yeah. I'm not sure, but it's certainly possible that we are, and maybe even in the Southeast. It's difficult to find independent hotel owners in today's world. So many of my colleagues are franchised or under management contract. It provides a sense of security when you do have a flag that demonstrates who you're associated with. We decided that we would do it ourselves, and that was a very difficult decision. But I think it's turned out to be a good decision. I'm not suggesting that franchising is not appropriate or wonderful, or that being a management company is not appropriate. But for us and the philosophies that we aspire to, I think being who we are is perfectly fine.
Now, I'd like very much to bring in the others to talk about RosenCare and all of those kinds of issues. But one more question to you before we get into that. Las Vegas is celebrating today because their first massive conference is coming back. The World of Concrete. It's going to be followed by several others in the next couple of months. Are you seeing the same thing in Orange County, Florida, where your Orlando hotels are located?
And listen, that's a great question, and the answer is yes.
Excellent.
Slowly but surely, the meetings market, the convention market is coming back. I think that people recognize that there is no substitute for getting together.
Yep.
The virtual situation was a good event, but people said, I want to be there. I want to rub shoulders. I want to talk to my friends and acquaintances. I want to be able to hear what they have to say. And so I think the need to have that kind of communication is driving associations, companies, corporations, businesses to begin to realize that it is something that they'd like to do again, and it's happening all over America.
Yeah, absolutely. And I can't wait until you start getting a lot more events so you can continue to bring back your team and fill up those hotel rooms. All right, so let's get onto it. Let's bring in Mr. Kenneth Aldridge and Ashley Bacow. So Kenneth Aldridge is a Director of Health Services with the Rosen Medical Center and RosenCare. And Ashley Bacow is President of ProVinsure, the in-house insurance company. Welcome to the show, gentlemen.
Thank you for having us.
Thank you.
Really appreciate you having here. So let me get this kicked off. Mr. Rosen, I'll get you to say the first thing so we could then pivot to those gentlemen over there. What made you go ahead and start creating medical programs and medical insurance and all of those kinds of things?
So, do you want me to kind of start? Yes.
Just kick it off, and then we'll get deeper answers from
Okay.
Ashley.
Well, we go back a long ways. When we were doing things in the traditional way, where we had an insurance company that represented us and worked all of our insurance obligations. We did things, as I said, in the normal way. I wasn't really pleased with the situation, but there wasn't anything I thought that I could do until one year back in the mid-70s, when I thought maybe if we focused laser-like on healthcare, even though an insurance company represented us, even though they made all of the arrangements with specialists and hospitals, if we could focus a little bit and drive our costs down, that would help our overall expenses. And so we did. We worked very hard, diligently, to keep our associates healthy. No smoking was a policy that we created. We would test for alcohol to make sure that our associates were not abusing alcohol, and then illegal drugs also. All of that helped us to drive our costs down. However, when we received the new rates for the new year, not only did they not go down, but they went up.
Right.
And so I made a phone call to the insurance company, and I asked them why that was possible. I said, we did such a good job. And they said, well, the group you're in did terribly. I said, what group are we in? We're an independent little company.
Yeah.
And they said, well, we put everybody in a group. I said, no. I don't want to be in a group. I want to be by myself. They said, well, that's not possible. And I said, why not? They said, that's just not the way we do things. And I said, well, it is possible. I said, no. I said, I'm gone. They said, okay, goodbye.
Right.
And now I was naked. Now what?
Yeah.
My associates needed healthcare desperately. What do we do? And so we did something a little bit odd. We were looking at our old accounting building, a freestanding little building, as being too small. And so we had to move all of our finance offices someplace else. And we were thinking about converting that small little building into a daycare. But daycare would only accommodate about 20 of our family children. And I said, Harris, you can think out of the box. What if you converted that into a little medical center? What if you had your own doctor, nurse practitioner, admin? What if you did that? And then something really strange came to mind. What if you had your own insurance company? Well, a little voice kept saying, don't do these crazy things, Rosen. You're going to get into trouble. But a larger voice, a stronger voice, a more convincing voice said, give it a shot. And so within a relatively short period of time, what evolved was our little medical center, not the same one we have now. What is behind you is the new center, about 5 times the size. And we decided to create our own insurance company, which we did. And suddenly, things began to change so dramatically. Our healthcare costs per individual, we refer to it as per covered life, declined from $2,000 per individual per covered life to about $750. Word got out somehow that Rosen had stumbled upon something that was a little bit different. We made the front cover of Florida Trend magazine. $750 per covered life, unheard of. And so that was the beginning. And so Kenneth and Ashley are a result, thank God, of that crazy idea I had to get into the healthcare business. And what they have done, with some little help from me from behind, is now created a healthcare system that I can say in all modesty is probably one of the finest in America. And when you rate healthcare systems, it's important to often rate it by cost. And they refer to that as the cost per covered life or the cost per individual. Our cost per covered life is about $6,000. The cost per covered life nationwide is about $13,000. And so what we said to ourselves, me and Ashley and Kenneth, what if everyone in the private sector and public sector had a RosenCare program? Would America save money? We crunched some numbers, compared the two cost per covered lives, totaled up the number of people in the public sector and private sector, and came up with a potential savings of $1.5 trillion a year.
Wow. Right.
May I now pass the baton to Kenneth and Ashley?
Exactly. This is incredible. So, Kenneth, it seems that natural to go to you first. How did you put all of this together in such a way that you're able to obtain such incredible, deep savings compared to what we're used to with healthcare here in the United States?
Well, first of all, thank you for having us. And it's truly an honor to represent Mr. Rosen and everything that he's put together in this program. But, first and foremost, Mr. Rosen talks about keeping things simple. Healthcare is not simple, but you can put things together to make sure that you're providing the services that your associates need. And we focus on 5 things: access, quality, service, cost, and innovation. And so when I came on board back in 1998, we just kept on listening to our associates, looking at the data, recognizing where the gaps in care, and focusing laser-like on the things that they needed. Out there in the real world, we have high deductibles, high co-insurances, high co-pays. Well, employers don't understand that all that does is it delays care. So 35% of Americans out there, not in Rosen, are delaying care because they can't afford it.
Right.
So from accessibility, Mr. Rosen allows his associates to stay on the clock when they're coming to the medical center. So that removes that mindset of, oh, I got to clock out to see my doctor. No. Mr. Rosen provides transportation to the medical center.
Wow.
So those components are removing the barriers to access. But then we started really focusing in on chronic care conditions. 75 to 85% of an employer's spend is going to be spent on those chronic care conditions. So why not? Why not focus on those? Your chronic care, such as high blood pressure, diabetes, high cholesterol, knock those out, get them under control, and you save the patient's life. And oh, by the way, provide better care and save money. But the things that we have done it's common sense. But we have not done things like the traditional healthcare market employers of cost shift, cost shift, cost shift. No, it's make it easier for our patients to, number one, get the services that they need. 90% of our medicines, our drugs, brands, generics, and specialty are available for free.
Right.
Mr. Rosen put together a program several years ago. I can't remember. We were actually speaking at the American Diabetes Association, and we pleasure of standing in front of everybody saying, guess what? Mr. Rosen provides diabetic meds and insulin for free.
Wow.
Versus what was in the Wall Street Journal probably around that same time about the $1 patent, but then these healthcare systems are charging $500-700 for insulin. So again, all we've done is made it simple for our associates and our patients to get what they need. So we as providers, and we have an amazing team of clinicians led by Dr. Ryan, to give them the tools that they need so they can get to the optimal care and optimal level of healthcare that they need. That's it.
Fascinating.
Remove the barriers, make it easily accessible, focus in laser-like on quality, and we're reaping the results associated to that. And I can talk for hours, but I'm going to let Ashley talk.
Yeah. Wait, hold on, Anthony, you're muted. I know Anthony wants to ask a quick question.
One of the things that stands out, Mr. Rosen cannot do the things he does with people who aren't passionate. And you've been there, I calculate, I think 22, 23 years, and you seem like you just started yesterday and you're trying to hold on to your job because you're so passionate about what you're saying. And that is why it's successful. So we can talk about the free insulin. We can talk about really concentrating on this. But if it doesn't come from your heart and it doesn't come with that, laser-like focus and passion, it doesn't get done. So just you're a tribute to Mr. Rosen and everything that he's done. And I cannot wait to hear what Ashley has to say.
Yeah. So Ken, we're going to get back to you in just a minute because I've got some very specific questions about your philosophy that I think hoteliers need to hear. But Ashley, the question I want to start off with you is, how does the insurance part play into it? Why is insurance even needed if this is something that's being created by Mr. Rosen and his team and stuff like that? How does it all work to make sense in your universe?
Oh, sure. So ProVensure has a couple of functions. One is to provide insurance, kind of catastrophic insurance for RosenCare, okay? And the other is to help others out there, other companies out there, implement a similar model as Rosen. So as it relates to the insurance, although we are self-insured and 99.9% of the money that is paid out to providers, hospitals, etc., comes out of Mr. Rosen's piggy bank. There are times when a situation arises and there's a catastrophic event, and we have insurance backup for things of that nature in order to keep the entire the program solvent. One needs to have that.
Right. As an example, if somebody had a tragic accident and found themselves as a quadriplegic, for example, that could diminish the entire funding for absolutely everyone.
Yes.
You have the backup in that particular case. Fascinating. And I also love that it seems like your role is to help bring this to other companies out there and show them that they can achieve this too by following your model.
Yeah, absolutely. And it's, when we did this, when Mr. Rosen, told the insurance company goodbye and said, "Oh my gosh, what am I going to do now?" That was 30 years ago. Now, someone doesn't have to take this big chance. All they have to do is say to themselves, I'm not going to continue with kind of the insanity that's going on right now. I'm going to kind of do something similar to Harris. And listen, every culture is different at every company. They may not do it exactly like us. It might be a tweaked version. So we have, it's not a buffet. It's a la carte. And what we do is, first of all, just share our story with them and let them know that, their second largest line item expense is healthcare. Okay, so you're technically, whatever business you're in, you're technically also in the healthcare business, and a CEO and a CFO needs to understand how that works. And so we share the story with the CEO and the CFO, and we basically let them know your cost can be half. And your coverage can be very rich, meaning no deductibles, zero co-insurance, 90% of your drugs are free. And what their employees really appreciate, their associates really appreciate, is the fact that right now they have insurance with that company, but the deductibles and the out-of-pocket is so high, it's almost like they're paying their little weekly, monthly premiums, but they're not getting anything because they end up having to pay for that MRI. They have to pay for that doctor's appointment. And so, I think the most important thing for folks to know is you don't have to go it alone like we did 30 years ago. Dip your toe in the water, do something a little different from what you're doing now, and you will be well on your way to basically providing a raise for your associates through them not having much out of pocket.
And excuse me, can I just add something? Because I think this is important. And you guys keep me honest. Our hourly associates pay on average about $850 a year for healthcare. And if you're in the hospital, the most you will pay is $750 twice. After that, you don't pay anything. So the most you will spend in a hospital in any year is $1,500. Wow. And we give you as much time as you need to pay that back. I mean, that doesn't exist anyplace else. And that's what makes what we're doing, I think, so incredibly attractive for all of our associates.
So how does it work, Ashley? If you have a small hotel, you're in Florida, you have a small hotel company, you have a couple of hotels, and you wanted to do the program that you're doing, how do they do it? How do they contact you? How does it work? And how is it
I'll dig deeper to that question.
How is it funded?
Yeah.
So there are a couple of answers to that. Okay. I think about 5 or 10 years from now, it's going to be a lot easier for a small hotel to scale and to get the economies of scale to do this. Right now, they kind of have to somewhat band together with others until they can get a critical number of covered lives in order to do this through like a captive, which is easily done, theoretically easy to do, but you got to get several of them together. But most are many hotels that have 200, 300 employees or more. It's much easier to the barriers to entry of this program is lower and easier. But in a nutshell, instead of using one of these big insurance companies, they can use an independent third-party administrator. And there are several of those around the country. They don't have to use the one we're using. You use a third-party administrator. You become self-insured. You have the protection of the catastrophic that I was telling you about. So by becoming self-insured doesn't mean, oh my gosh, if I have this big claim, I'm going to go broke. Okay, so again, you become self-insured. You have an independent third-party administrator, and then we help you. You may not have the resources or the scale to open up an on-site clinic. But you don't have to go into the bricks and mortar business. We have ways to put you with a doctor who acts much like our doctors and is looking, has the tools to fix you and to get you to high quality specialists and high quality hospitals.
Yeah. But what I find interesting, during this whole pandemic, you did not hear one government official talk about taking care of yourself, eating better, taking vitamins, and really take care of yourself. Because as you saw, most of the people that got into real serious damage were people with COVID, were people that had underlying conditions. I think the overwhelming majority. What I like about what you're talking about is you're I would imagine training and talking and informing your team to prevent a lot of things that would be costly, prevent a lot of things that would be catastrophic, and prevent things that would put people in the hospital. So how do you do that?
Kenneth, I'm gonna turn it over to you for that.
Absolutely, this is the fun part. But I wanted to go back. I want to make sure you heard $850 per year is what we were talking about. Fortunately, I met with a large specialty practice, and I was just curious and talking to their CFO and asking how much do their associates pay. They pay $800. I think they said $800, and I'm like, oh wow, that's great that you pay $800. Then I asked, it's a month, exactly, Anthony, and that's a problem, and we've got to help everybody find a way to fix that. And exactly what Ashley was talking about, we have those methodologies. So yes, Anthony, prevention and wellness is something that is key for Rosen Hotels. I mean, as we bring in new associates, our dream is to be able to say, we need to get you a mammogram and get you all of the prevention, the colonoscopies. We have all those resources. That's ideal. But when we have our associates coming from from third world countries or other areas that they don't have access to healthcare, right, we don't have that opportunity. And I want to stay away from the details on clinical, but sometimes their diabetes is way out of control that if I had their level, I'd be in a coma. Or their high pressure is so out of control that it's just, we're trying to save their life. And unfortunately, that's not too uncommon. But having all the resources that we have within the Rosen Medical Centers, from MDs, DOs, nurse pracs, dietitians, labs, pharmacy, physical therapy, everything under one umbrella at the Rosen Medical Center, it gives our team the opportunity to save that individual's life. So I'm going to give one example. We had a brand new associate who came to us, and she is 47 years old. And our typical spiel is, hey, before you even come to see our provider, you're of age to get a mammogram and a colonoscopy. Wow. And she blatantly said, I'm not getting a mammogram. I've never had one done. I'm never going to get one. And we just listened. Over 3 months, we developed a relationship with her, and able to get her to a point where we were able to alleviate that fear because we had our mammogram day going on at Mr. Rosen's Rosen Medical Center. Our doctor walked her to the bus to get it done. And all of a sudden she said, hey, it's not as bad as I thought. I'm going to go ahead and get it done. Thank God we got it done, because what did we find?
Right. You found something.
We found breast cancer, but it was in an early stage that we saved her life and did a lumpectomy. And oh, by the way, we saved her life. And guess what? We Rosen Hotels saved money.
Yep.
That's the common sense stuff that we're talking about. Just makes sense to make sure you remove the barrier to the access to care and bring it to the person. Because we established this mammogram program back in 2008, just to increase the probability that we're going to get the patients what they need at the right time, at the right place, at the right resource. Right. So that's on the prevention side. And
so
we've got
on that prevention side, I think it's important to really unpack this for a moment. One of the things that hoteliers typically are, and they don't even realize they're doing it, is they fall into that penny wise, pound foolish type of a thing. They think they're saving money, but they're not actually saving money. You are all saving money by spending money, by paying for associates' time to go do these things. And because of that, you're getting folks more engaged in the process, and they will finally, because so much of us feel overwhelmed or intimidated or don't have the money to do it, to be masters of their own health, to learn those lessons and stuff like that. So what you're doing is you're not just helping them be healthier. You guys are driving all of those savings to the bottom line, because as you just said, the hundreds of thousands of dollars that was probably not spent by doing a lumpectomy versus something that could have been a whole lot more serious, is the way to think about these things. Not only that, Kenneth, but I'm sorry to go off on a rant here, but everybody is complaining about labor and hiring labor and stuff like that. I can't imagine being a part of a company that has great culture as you are. And I'm not saying that because I know, I'm saying that because people in our chat rooms are saying how much they love the culture. Why would I leave that job for 25 cents an hour, for 50 cents an hour more, when I'm saving thousands of dollars a year and able to better take care of it?
It's not even, I bet you they don't even calculate how much they save. I think they feel protected. They feel loved. They feel cared for.
Right.
You know, if you look at a family and you see them walking through the amusement park, you can tell the children that feel comfortable and loved, whether their parents have $1 million in the bank or whether their parents, were just able to get them down to Disney World. There's a feeling. So I think at some point, yes, the cost and yes, the savings and all that come into play when they take the job. But when they stay in the job, they feel protected and loved. And even if their expense went up a little bit, I don't think they would care because they feel protected. And you said something before, Glenn, I think is very important. Hoteliers are penny wise, pound foolish. And I think a lot of businesses are that. And it's not that they don't want to save the money. It's not that even they don't care about their employees. But what do they say? What you focus on gets done.
Right.
And it always comes down to one person.
Right.
That was Mr. Rosen. He focused on it and it got done. And too many times, there's too many people at the table all taking votes on something. And Mr. Rosen said, you guys are fired. I'm not going to deal with it. Oh boy, I'm in trouble. And now his laser focus is what got this done. And in most companies, you don't have that one person willing to put stick their neck out to get it done. That's why you see in our government's a mess. That's why you see in most most companies are a mess. And that's why you see a person paying $800 a month for insurance that's basically making $800 a week. So 1 week a month they're paying for insurance.
Right. Mr. Rosen, so let me bring this back to you, because you're citing these great savings that you were able to bring to the table. But my guess is one number you're not factoring into that is having to replace employees over and over and over again. I guarantee, I don't know this, everybody who's watching this right now, I guarantee you have a much lower percentage of turnover than any other hospitality company in the United States. And every time you turn over an employee, we talked about this before, it could cost thousands and thousands of dollars. That's all money now that you could drive straight to the bottom line. Am I right with that assumption, Mr. Rosen?
Yeah, you are correct. Our turnover is most likely the lowest in the industry by far. If you visited us, and I hope one day you will, and you ask our associates a number of questions. Do you like our healthcare plan? Of course they do. By the way, I think we've saved, since we started the program, about $450 million on healthcare costs. But they would say yes, they do like our healthcare plan. They do like working for Rosen, and they just love the whole environment, and I think healthcare certainly does help retain our associates. And if you walked around our property as I was suggesting, and you say hello to our associates and ask them how long you've been with us, it would be very unusual to find someone who's been with us less than double-digit years. So 10, 20, 30, 40 years, not unusual when you ask one of our associates, how long have you been with Harris? And they would share that with you.
Who's your oldest employee right now? The person's been with you.
You know, we've been in business for 47 years, and I suspect we have a couple who started with us back then.
Yep, amazing.
But it's not unusual. 30 years, 35 years. Kenneth, how long have you been with us?
23 years, sir. But what's also most important, Anthony, is not only that single employee, we've got now generations. I know of one family that are 4 generations working for it.
Ashley, how long have you been with us?
Years.
How many? Say it again. I had you on mute.
22.
Wow.
You know what's amazing? This is the exception, not the standard. And back in the day, this was the standard, right? If you go back 30 years ago, people would stay in a company 20 years, 30 years. So because people, their lifestyles have changed, the way they function as a family unit has changed. So they don't stay in a company for 20 years. But to stay in a company for that long, again, has less to do, in my opinion, with medical benefits and pay, and a lot more to do with you're safe. Like they expected during the pandemic that the medical center is going to be there. They expected that you were going to hold on as long as possible without furloughing anybody. That was an expectation. Whereas you look at other hotels, I'll give you an example, like at Wynn in Vegas, everybody was shocked that they held on to their employees. And it was great for them. It was a win for Wynn. However, with your company, it was an expectation because that's what you've done in the past. And that's when you really start to do something and really 4 generations says it all.
Not easy. It's been a very, very, very difficult time for us, and I just hope and pray it doesn't happen again. There is no doubt a light, albeit a flickering light, at the end of the tunnel, and things are getting better. All of our hotels are open now. We just opened the last 2 a few months ago, and occupancies are still awful, but we're seeing more and more occupancies rising in the 50 to 60 to 70% range, and with 7,000 rooms, that's not so bad at all.
No, I think by September, you're going to start seeing 80, 90% occupancies. I think it's going to be crazy. And what I'm seeing and what I'm hearing in Disney World, the lines are as long as they've been in a long time.
Well, they're still doing things a little bit differently over there. The problem is I don't believe it's a demand issue. It's a supply issue. The Walt Disney World Resort is still running at something like 50% capacity or so. So that doesn't surprise me, Mr. Rosen, that you have a lower capacity. As those numbers are starting to lift, we'll get back into it. Right now, you have to make reservations to get into the theme parks, and it's nearly impossible to get into any of them for the next 2 months. So that shows me people want to come. It's just a matter of them loosening up a little bit.
Before we go on to other things, and we're talking about insurance and healthcare and business, what I want to hear from Kenneth and Ashley is take one moment of your 20-plus year tenure with Rosen and give me one moment that stands out. Besides saving the woman's life, Kenneth.
Yeah.
One moment? 23 years. Every moment that I've had with Mr. Rosen and Ashley in this company has been amazing. So thinking of one moment.
It wasn't the moment
being on this podcast?
It wasn't the moment you came.
Yeah, being on this podcast. But no, being part of a team that is getting to speak to other employers. And Ashley was talking about we sit with CEOs and CFOs. I come in with the perspective of, I looked at one of the financials, one of the CFOs, and I said, they said that they cared about their employees. And I pushed back the document and I said, you don't. And the CEO looked at me and said, why do you say that? I said, because you're charging your employees $5,000 deductible and all these premiums and those kind of things. The CEO looked at the CFO almost with daggers flying out of his eyes. So at one moment, I can't think of a moment, because we've met with senators and congressmen. We've had large employers flying down from that big pizza chain to come and listen to what Mr. Rosen's done. One pivotal moment is just the sadness in how more employers are not doing something that Mr. Rosen and Ashley have proven for 30 years. I don't get it.
Yeah, Ashley?
Yeah, what resonates with me with that question is a conversation that I had with my mother about and she always talks about this to this day, was probably about a year after I started. And I said, Mom, the management structure is just kind of, how do you like your new job, Ash? And I said, I like it, but management structure is kind of weird and kind of different than anything I've ever experienced. I came from GE to here, and although Mr. Rosen and Jack Welch, have a lot of things in common, the structure is different. And what I told her is, I said, Mr. Rosen actually sits down with, for example, the housekeeping team at each hotel, right, without their manager in the room, okay, and just sits down with them and says, hey, how are you doing? How is your manager, treating you?
Right.
And a lot of good things, come out of that when you give someone a voice, someone who may have used to work for someone who was maybe somewhat oppressive and just said, hey, I'm your manager, shut up, do your job. My mother to this day just cannot get enough. She goes, if every organization was run like that, she goes, there would be no need at all for unions.
In doing Hotel Impossible for 10 years, one of the things that I hear a lot when I'm walking through airports or restaurants is housekeepers or people in maintenance will come up to me and say, just what you said, thanks for giving us a voice. When you put that out there and you show employees and guests that you care, or employees that you care, and just, again, not everything's got to change overnight, but that they have a voice. And that's what Mr. Rosen has done throughout his career. But when you're just laser focused on profits and you're laser focused on winning the race of who's got more money, you don't see your employees. I mean, I've never met an employer or boss, a CEO or general managers and say, we care about our employees. And I usually call BS on it, because to your point, Kenneth, just look at the way you're treating them. Not so much, maybe you're giving them free lunch. Maybe you're being nice to them. Maybe you have good supervisors. But when you're taking something that's $5,000, when you say $5,000 to a person that's making, $15 an hour or whatever it is, that may be for someone that's making a lot of money. Okay, it's expensive, but I can afford it. 5,000 might as well be 100,000.
Right. Yeah.
You're absolutely correct.
Yep. So, Mr. Rosen?
Yes, sir.
So why? This is such a great idea.
End it right there. Just why?
This is such a great idea. Why are you struggling to get other hotel companies and other businesses really to understand that they could take care of their employees and save, like you have, hundreds of millions of dollars? What is going on that there's such a disconnect?
Because humans are complicated.
Yeah.
Yeah, that's a great question, and unfortunately, I don't have an answer. Look, we have other initiatives that we have been doing for many years. Mm-hmm. I don't know if you've heard about our Tangelo Park initiative, mm-hmm. where we provide free preschool. In fact, last night I was at the graduation of the preschoolers, 30 of them, moving on to kindergarten. That was the 30th time I'd been to at the preschool graduation at Tangelo Park. Free preschool. We work with moms and dads and the youngsters to make sure that they graduate from high school. High school graduation rates have improved from about 50% to 100%.
Wow.
And then if our youngsters are accepted to community college, four-year college here in Florida, or to a trade school, they don't ever spend a penny. We pay all of their expenses. We've been doing that for 30 years at Tangelo Park, and 6 years ago we adopted another community, Paramore. So when you do things like that, I think your associates really appreciate the company more. And for some reason, and I don't really quite understand it, not too many companies are engaged as we are in the community. We have a Jewish community center. We have the Rosen College of Hospitality Management, now ranked #1 in the world.
Wow.
I went to Cornell, and when I sent them a little note saying we're #1, I expected a congratulations. I didn't hear anything from them. Yeah. And we do a tremendous amount of work in Haiti. About a third of our associates from Haiti.
Wow.
And so when you're engaged in things that are not directly related to your enterprise, I think people really appreciate that and say, you know, this guy cares about people, not only about the bottom line.
Kenneth?
Yeah, so what I'd like your listeners to really hear is Mr. Rosen's done the right thing to help these kids graduate and move on, but he's actually impacting what is called social determinants of health. And social determinants of health impact healthcare more than anything else. So social determinants of health actually impacts healthcare by 60%, while medical is only about 20% and genetics a little bit more than that. So he's providing education for these students that is going to improve their healthcare as they move on. They're also going to impact their children. So he's doing things somewhat unintentionally that is also impacting the future of healthcare in America.
Wow. That's absolutely incredible. Our hour is almost up. I cannot believe how quickly this has gone. So, Ashley, let's start with you. Any final thoughts on what people should take away from today?
Yes, I think what I would do if I were someone who was listening to this is think outside the box a little bit. Try to do something a little bit different. And if you don't, you will be on this trajectory of healthcare expenses that will not go the other way. It will not. So I would just say you don't have to recreate RosenCare overnight. Just do something a little bit different. And I think once you see the savings and the quality improvements in somebody's healthcare, next year you'll do something a little bit more and a little bit more and a little bit more, and you'll get out of this healthcare spiral.
Beautiful. Kenneth?
You know, the bottom line is employers can do something. They can start somewhere. They can recognize what is going on with their associates and help provide. And yes, that will help them stay with your company a lot longer, improve absenteeism, improve presenteeism. So many aspects of healthcare can be impacted, but employers need to be the one to step up and recognize that they have to do something about it. But it doesn't have to be the 12,000 square foot Rosen Medical Center. Take steps, but do something about it. Mr. Rosen's done it over 30 years, and he's proven the point.
Great. And Mr. Rosen, now that we've proven that point, as hoteliers and business owners that would like to do something, what are the first steps that they can do to bring your vision to life in their company?
Well, it's not easy.
Right.
And so the first thing would be to take a deep breath and have a conversation with yourself and ask yourself, am I happy with the way things are going now? Are there any things that I could do that might make lives easier for my associates? Anything at all that I can think of. And if you think of some things, then have conversations with your team and ask them, these are some thoughts I have. How do you feel about it? And if indeed there's a consensus, don't be afraid to take that step. Listen, I'm so lucky because I don't have a board of directors.
Right.
I'm not a franchisee. I'm not managed by somebody else. I don't have multiple owners. And so I don't want to suggest that what we do is easy for everyone, but you sometimes need to take a deep breath and take a chance, especially if you believe in what it is that you're going to move forward and do. And so life is not forever. And while you're still here on earth, try the best you can to give others a helping hand. And so that would be my advice. Offer a helping hand to those in need, your associates, your family. It sounds simple, but it's not.
You know, a lot of people in your situation give away a lot of money, either at the end of their life or big sums of money over a period of time. And that's great. And that helps a lot of communities. But one of the things that you're doing that I really want to make sure that everybody understands is you're taking away stress. There's one thing about giving people money and giving people families money and helping them, supporting them through different periods. But over a period of 10 years, 20 years, 30 years, you're giving them a better quality of life. They may not be making $1 million, but they feel safe. One of the things when I went in the military, I remember, as you, Mr. Rosen, when you were in the military, you felt safe. You felt protected. You knew where your meal was coming from. You knew where your paycheck was coming from. You knew, you just felt safe. And that's what you're doing. And so this hour has really, that's really penetrated me. That more than money, more than healthcare, you're reducing the level of stress in families.
So it's interesting that you mentioned the military. I spent a little over 3 years overseas with Uncle Sam. And there are two things I've never forgotten. KISS, keep it simple, stupid. And PPP, prior planning prevents piss
Poor
performance.
Colonel Hallams in the Army, and I was in Honduras, and he looked at me and he goes, piss poor performance, preparation, or whatever they're saying is. And it's resonated with me my whole life, and it's true. Preparation. And again, it's just staying in front of what you know is coming down the pike for families. And listen, we've all had our level of stress. And again, Mr. Rosen, I'll never forget your face the day before you had to make that decision. And when you're reducing the level of stress in families, that's really terrible. That's more than money.
No, that was
nothing that can buy that. So thank you so much, everyone, for coming today.
Thank you.
God bless you both.
God bless you.
Rosen, next time, Anthony and myself will try to get to see you in person.
Oh, that'd be wonderful.
I know.
Mr. Rosen,
Thank you for having us.
Thank you, guys.
Appreciate it.
Thank you so much. God bless.
God bless. Wow. I got to tell you, Anthony, that was incredibly moving and really highly practical and smart at the same time.
I'll tell you something. I love him more than I love you, Glenn.
Well, that's not surprise.
All right, a great show.
Yeah,
I was talking to Glenn yesterday, and I'll share because I'm a transparent person. I was like, Glenn, I feel like the last couple of shows we've been talking about the same thing over and over and over and over and over again. And this is a great show where it's mind blowing about how one person can change so many lives. I mean, I want to know how many people that went to pre-K 30 years ago actually worked in the Rosen family.
I'm sure many, and I love that there's multiple generations of families working there with him.
Yeah, and I also want to tell Resorts World, I think they stole Mr. Rosen's logo.
Well, don't tell them that until the opening of Las Vegas. All right, everybody. Thank you so much for being here today. Now, we know a lot of you all like to listen as opposed to watch. You can listen on Apple Podcasts, iHeartRadio, Stitcher, wherever you prefer to download your shows. We're there for you. And if you want to reach out to either of us personally, he's Anthony at Hotels. I'm Traveling Glenn. Anthony, any final words of wisdom before we leave it for the day?
No, sir. Just follow Mr. Rosen everywhere you go.
Yeah, absolutely. What an incredible show this was. All right, everybody, we'll see you tomorrow. And remember, until then, you've got one life, so blaze on. And then
be kind to yourself.
See you all tomorrow.